And we are live. Today is Thursday. My name is Mark Tremblay. I'm with Weedwell. And being Thursday, that means that my colleague Paul Calori is joining me for our weekly learning and knowledge session. And today's focus will be on how to find your right cannabis dose. And I will start off by saying that, as simple as that may come across, there's a lot that needs to be considered before you arrive to that conclusion. So, Paul, welcome.
Thanks, Mark. We'll get right into it and we'll talk manifesto. And today, how to find your right dose. It seemed appropriate to say, I know cannabis is my medicine, it helps me. And many people have come to that conclusion over the years, either on their own or information from a friend, read a book or information online. But they've come to that conclusion that, hey, there's something to this and it's helping this symptom or that symptom. And, it's helped them out a lot. So that's the easy part to tie that in. Where this topic came from, there's kind of two ideas. And we've talked the roadmap the last 2 weeks, specific to the topics at hand, and I wanted to continue that trend. But we're not just going to talk about the roadmap. We're going to talk about the journey with how to find your right dose and how it applies in kind of each section. And there's 5 stages or 5 sections, and we're going to relate that in that way. But the other thing was, and you were slowly or kind of touching on it there at the start of your own introduction, is that question of finding the right dose. It seems like a simple question. And what I recall in the clinic, perhaps you can share a little more details, is often that was the first question from some clients that would come in, or once they of course describe their symptoms or whatever. That was one of the first questions. You want to share some on that and what you saw?
Yeah, absolutely. And you are right. A very, very common question that would arise fairly early on. Um, well, two things. One of them is, in order to determine the right dose, you need to think of what is it that I'm taking in and what is the makeup of that. So the percentage of THC and CBD, or both, in the case of a dry flower. In the case of an extract, what is the concentration, again, of the cannabinoids? Because that's really the place to start to come up with that. So the question would come up, the way we just described it, and we'd have to lead into it with some other variables that need to be addressed. But I will say that, and you've used this term before, Paul, that often it's not unusual for a client to take more than what they actually need. They just want to make sure they get it under control. And you've used this example, and I'm going to piggyback off of that, is if you're washing your clothes and it requires a half a cup to get things cleaned up properly, putting in a full cup is not going to make the clothes any cleaner.
Mm-hmm.
And this is very similar as well, but it's not an unusual thing because people just want to make sure that it is dealt with, and they will stick with that. So often we say, let's go back a step. Let's look at your medical conditions, which brings us back really to the be clear, the first stage,
Yep.
and really start with that. Otherwise, it's a hit and miss. It can go, either direction, and it's really not foundational to getting us where the client would like to be and where we would like to see the client, Paul. So I'm not sure that I've answered the question, but just emphasize that it's not a simple answer. There's a lot of variables that need to be considered.
Yeah. You've answered the question quite well. One thing I would say, the background of the clients that come in over the years, client with chronic medical conditions, excuse me, they've seen lots of doctors, they've gone through lots of treatments and therapies. They come by this question honestly. This is a new therapy, but they've gone through the try taking this twice a day for the next 3 weeks. I'll call you back and we'll figure out where you're at. Okay, increase it to this. It's always doctor directed, these medications, these treatments, or whatever. So it makes sense that they would come into the clinic and say, Doc, what do I take for my. And the thing that we've been talking about, almost to some extent preaching all along, is this is something that you can come to the conclusion on your own. This is empowering. We want you to do it. And more importantly, once you come to that conclusion of what you're going to take or how you're going to take it, and when you're going to take it, we give you the tools and the abilities to adjust that on the fly to get to that right dose. But often, to the last thing you said, we'll say, hold on, we're not ready to talk right dose yet because we need to go back to be clear, as you touched on. And so, in developing this conversation, I'm going to relate it back to podcasts that we've already done. They're all available at podcast.weedwell.com. And if you kind of take little bits of information, if you're listening today, and take little bits of information from each of these podcasts, you actually have the information there and the abilities to get to the answer of what's my right dose? What am I taking? So at Be Clear, for a quick review, this is the health selfie. So understanding what medications you're on, why you're taking them, what you're taking, how often you take them, and more importantly, what do you hope to accomplish? The doctor gave you this medication. If it's a blood pressure medication, your goal is to lower your blood pressure. And so understanding that from a medication standpoint, but also understanding what you're going through. And so what we'll hear is, I have anxiety all the time. I have depression every day. I'm in pain all the time. And it's an apt description. That's what the person's feeling. But you really need to delve into, well, is the pain out there all the time? Does it come and go? Are there things that I can do? Are there things that are total no-nos? And identify your pain or your depression or your anxiety in those terms, and really start getting clear on the specifics as opposed to just saying, I have pain. Now, we have health selfie episode. We actually have two, number 28, again, podcast.weedwell.com, and number 44. And they're both designed to get clear on yourself and really paint that picture. So that would be your starting point, because you need to understand where you're at in order to find your right dose. And the information you glean here is going to, in turn, mostly direct you towards cannabinoid and the type of consumption method that you have. I'll tie that in a few minutes, though, when we get to Be Informed. Did you want to add anything to the Be Clear, Mark? Or okay. Sorry. Now we've got to be aware as we're tracing our way through the map, and be aware is really where we're going to develop an idea of where we want to be some point in the future. So if you understand Be Clear as kind of the past and where you're at today, we need to get to a better place. If you're looking to medicate for something, anxiety, depression, pain, what have you, you're in a not optimal place. We're trying to get to a better place. And so we have really two topics we touch on in here from previous podcast episodes. Number 29 is something called Cannabis is not a one-size-fits-all solution. And the other one actually takes you through developing a health goal, a SMART health goal, using the SMART acronym, specific, measurable, achievable, realistic, and time-sensitive or time-bound. We go right through each one of those letters in developing your own health goal. So these become important in so far as what you're taking, because now you have somewhere to aim your treatment to go to in a basic sense. Mark, did you want to touch on a little bit of the cannabis not one size fits all solution and kind of the misconceptions from person to person or friend to friend and that?
Yeah, absolutely, Paul. That was my topic last evening, actually. So it's not unusual for someone to come and see us and say, my friend, my coworker, my relative is suffering from chronic pain and has found significant relief from the use of cannabis, suggested that I should try as well. Well, that's not a bad place to start, but it's not a one size fits all, as you've said, and Paul. We need to really assess, first of all, what is the nature of the pain for the other individual, but more importantly, what's the nature of your pain? Perhaps the person that referred you, their chronic pain is as a result of an injury, for example. Maybe yours is neurological. So right there, although they are chronic pain, the way you're going to treat that is going to be different. So it's not a one size fits all. There's a lot of variables as well. Your own personal genetics, so your makeup, the genetics of the cannabinoids that you're going to be consuming. So once again, it's there's a lot of variables here that need to be considered and addressed prior to.
Exactly. And even as you were talking, I was like, some of this is going to run right into be informed and some of the factors as you just talked about. Um, and, be informed. This is really where, if we had to place this question, how do I find my right dose? This is where it belongs, because the goal in Be Informed in our roadmap is to design that treatment plan. And in the treatment plan, we have type of cannabinoid. So we're talking CBD or THC. We're really not getting too picky at this point, and trying to hone in on this, that, or the other thing. Start with a cannabinoid. We're trying to identify method of, or methods, if you're going to use more than one, of consumption. And then the when, as far as time of day and how often during the day are you going to take the cannabis, and do you want to medicate? Now, this ties into the be clear, as I mentioned earlier, because if you have symptoms that are there really all the time, because you've done the legwork to feel, I'm in pain all the time, it is really all the time, then probably a longer acting cannabis medicine, so a method of consumption like ingestion or sublingual dosing, is more appropriate for you. If it's something that comes and goes, if it's something that has a quick onset like a migraine, maybe inhalation is proper for you. And we've had this conversation before, where doing the legwork at the start really dictates, at least from method of consumption, I'll get to cannabinoid in a minute, what you might gravitate towards the first time. And I think that's important to say, the first time. There's nothing to say that you're going to get it right. And you know what? That transcends all medicine. There's a reason why the doctor starts you on a blood pressure pill at a very, very small amount. And then you go back and you take your blood pressure and it's no better. Well, they inch you up. If they give you too much blood pressure pill at the start and you pass out, bad things happen. So the same idea is the cannabis medicine. There is a start low and go slow approach, the same as, we'll say, standard or conventional medicine that your doctor would do. So there ties in the legwork to method of consumption and why be clear is important. Insofar as cannabinoid goes, first off, let me introduce episode 27. We talked about THC in detail. And episode 28, we talked about CBD in detail. So the best we can give you, and Mark, you and I on these Thursday discussions have given, we'll say, outlier scenarios where what we think people will respond well to, it ends up being the exact opposite. I think you've given the Gravol example from a conventional medicine, where most people will be drowsy, and you're quite the opposite end of drowsy. So in those discussions, though, we do talk about THC in terms of maybe being good for pain, CBD for inflammatory type conditions. There's inflammatory properties to THC as well. And just kind of, we'll say, an overall, as opposed to saying you need this strain with this much percentage CBD or THC to alleviate this symptom. What we really focus on, though, is what does your life look like with those cannabinoids is more important consideration. So if you're working each day, THC is already a no-go during the day. And so you might only be able to use that at night. And so your life circumstances already dictates what cannabinoid you can try, at least at the beginning. And then, based on the same life circumstances, let's say you're a Monday to Friday person, you can start to introduce THC at a later point in time. But you only get really generic information because there are enough outliers to say, you know what, you guys thought that the CBD would help with this condition, but it was the exact opposite. I went with THC and I haven't felt better in my life. And we hear those stories enough. The classic that I recall hearing a few times, at least in the clinic, is the idea of using THC and indica at night for sleep. And people would turn around and say, I kind of went the opposite and found a sativa that worked for me. So you'll get generic on what we'll call it a good starting point, at least a good trial point to design your own treatment plan. So if you find that a condition fits in here, that's a good starting point. And introduce cannabis that way, in a way we call start low and go slow. For methods of consumption, I touched on briefly at the start here, but if you want more details, we have a whole discussion on ingestion, episode number 31. We have a whole discussion on inhalation, episode 39, and we just finished one a couple weeks back on sublingual dosing, episode 46. Now, the one missing is topical, and it's just hasn't been done yet. We'll be getting to it, I imagine, in short order. But each one of those methods of consumption now, we talk about and how it might work into your life and what's appropriate for like the long acting medicine versus the short acting medicine. And again, you can just glean little tidbits of information. And if you're really looking to do this on your own, there's 5-6 podcast episodes there to get a treatment plan. And believe it or not, we did a whole nother one, number 32, on designing your own treatment plan and kind of putting it all together. So really finding your right dose, the meat and potatoes is in Be Informed, the section that we're talking about right now, with the goal being design your own treatment plan. But as I touched on, a lot of the information comes from the legwork that you did in becoming quite clear on your health selfie and what you're dealing with, how often you're dealing with, and whatnot, and really identifying that primary or that focal condition, as opposed to some of the secondary symptoms that may be coming from that, and then going into picking a cannabinoid and a method that you're going to try.
Mm-hmm. So, Paul, one thing that we need to underline here as well is that in addition to start low and go slow, always listen to your body. How is your body responding? And we always encourage baby steps to progress. There could be some that you respond differently than most would, and you've touched on that. But and it's true that for most chronic conditions, a ingestion method, so oil under your tongue or a edible is recommended because they do last a long time. And then for the onset of a migraine, for example, is that introducing vapor or smoke could be very effective as well. But to add one more little twist in that is in your Be Clear, if you've identified that you suffer from COPD, then we need to consider that as well, because smoking is probably not a good idea. So all those things, that's why it's so important in the Be Clear stage to take your time and reflect and document and find out what you're actually being treated for.
Yeah. Often what I recall in a clinical setting, along with that situation, is the person who gave up smoking. I quit smoking 5 years ago. I don't even want anything close to my mouth in that manner, because it's memory, it's muscle memory, and the whole bit. And so very fair consideration in coming to the method of consumption. In any event, once you kind of get to a cannabinoid, THC or CBD that you want to try, how often you may want to try it, and then how you're going to try it, if it's going to be oil underneath the tongue, and make that your treatment plan. That's going to drive ourselves into be progressing our next stage. And really, it's a continuation or an onset of your actual cannabis dosing. And we have a quick tips episode, we called it, episode number 22, on titration. So, titration in simple terms is adjusting your medicine. So, earlier on in our discussion today, I gave the example of the blood pressure medication from your doctor who might start you on a very small amount, and they inch it up as they're getting a response to what your blood pressure is, hopefully dropping. And they do that in small calculated steps. If they give you too much and your blood pressure drops too much, bad things happen. You'll probably pass out. So we're implementing that exact same idea, except you, the doser, if you will, you're the one who's going to be doing it. And again, we're all about empowering. We're all about giving the tools, the skills, whatever, what have you, that enable you to do this. So the good starting point is the episode 22 on titration. But this ties into an important thing called health journaling. We talk often and often and often about. And this is a podcast episode again on its own, number 19. And here's the rationale for that. Journaling forces you to talk about, when I say talk about, I mean actually describe, write down the type of cannabis that you're using, when you're using it, the symptoms that are either relieved or not relieved, and any side effects that might arise. And that can be to the CBD or the THC or just something completely off that you didn't notice before you started dosing. But the idea of writing it down day by day by day, it allows you to see trends. To go back to the be clear when the person comes in, I'm in pain all the time. Well, until you actually write that down, you may actually be in pain all the time, but you might realize it's not all the time. It's when I do this or it's that, because you've actually taken the time to document it. Well, in dosing, it's the same thing. If you start noticing I'm feeling a little bit better, we want to define that. I feel better in the mornings, and when I actually write it down, my afternoons aren't very good. My evenings aren't very good. Even though I kind of relate to I feel better in the mornings now. Well, now that gives you information to adjust your dosing. So that might be adjusting the time of day so your afternoons become better. Your journal literally leads back to how you're going to adjust. You said an important thing, Mark, that we tell everyone, listen to your body. Your body's telling you, listen to your body and what it's saying. And so when you journal, hey, I feel good in the morning, but not in the afternoon, I can adjust dosing to make my afternoon as good as my morning in this example.
Also, yeah, for sure, Paul.
Yeah,
I just wanted to piggyback off of that. When you are journaling, all the reasons that Paul just mentioned that are so valid. Also, if you are meeting with your family physician or even one of us, when you have those notes in front of you, you're not relying on your memory or perhaps other things that might distract you. It's very clear, it's concise, and that really helps in the entire process as well, whether it's with your family physician or even a specialist or one of us.
To continue on the titration or the adjusting path a little bit, when we talked about, or when I mentioned earlier, pick a cannabinoid. Let's use CBD as an example, and you start with an amount in your pipe, in your vaporizer, in your syringe. It doesn't really matter in this case how you're taking it. Just pick away and stick with it. Be consistent. But as you have no effect, your journal says, I feel the exact same day after day after day. That tells you can take a little bit more. provided there's no side effects or adverse reactions that you've documented. But you can start taking a little bit more, and you want to give yourself a number of days, a few days to figure out what that might be like. And you can inch up and inch up, but it gives you a step by step process where it might be step 2 or step 3 where you actually begin feeling therapeutic effects before you pitch it all away. But again, the only way to really kind of see your journey as a whole is to have that documentation, because quite frankly, it's rare for the person to start cannabis on day 1 and feel good on day 3 or day 4. It's usually a weeks long, if not a months long journey to really get to a better spot, is quite often what we saw in the clinical setting. And so give yourself an idea. If we're talking months long, you might have 30 or 50 of these things, but that's the only way you're going to find out trends, because when you start looking back, for me, what I find in my own life is I have a recency bias. So if something happened to me in the immediate past, that's what I remember. But I don't remember all the good things that were happening before that. You get focused on the one event. Journaling helps alleviate that. We'll continue into Be Well now. And so as we adjusted our dosing, whether by amount or one thing I should mention is you can change cannabinoid as well. So it's not that you just stay with CBD. You can go to THC, or you can utilize a blend, some THC, some CBD. I would just say one last thing, don't change too many things at once. So try one thing, get a handle on how it's working or not working, then attempt something else. But this is kind of your new beginning. And so we've done an episode on complementary and alternative medicines and how they might fit into your treatment plan. So this is hopefully a point in time when you begin starting to feel better. And one of the reasons why we call Be Well, you're much closer to wellness. And that episode is episode number 36. And these are the things that we can do in addition to or instead of traditional treatments. And there's no right answer. We see people benefit both ways, whether it's instead of or in addition to. But these are the things that are out there, whether it's chiropractic, whether it's an aromatherapy. It doesn't all have to be physical as well. It can be teas and stuff like that. There's lots of things out there that kind of, we'll say, in the alternative sphere. They can all help you along your path to wellness as well, in addition to the cannabis. And the other thing is we talk risk factors in episode 41. And the risk factors are really focused on the wellness aspect of things. So as things begin to, we'll say, improve a little, what are the things that you can do, again, to help propel that treatment forward, that path to wellness, moving along? And it's things like coping mechanisms, support systems. You know, we even talk about your physical environment and how it may affect you negatively or positively in that episode. That's episode number 41. And, you know, that all culminates back to, guess what? Your new health selfie. And so we're right back to episode number 28 or 44 in podcast.weedwell.com. I know I'm throwing a lot of numbers out here, but it's actually remarkable when you look at the journey and the roadmap, Mark, how many episodes have been dedicated to, well, first off, each of these 5 stages, but more importantly, each of these little steps that we've been talking about. And I know in your own day-to-day lessons, whether we call it map 1, map 3, map 5, all those maps, if you will, they relate to the little micro steps, but we actually have discussed just about every single one of them. And it's all about those accomplishing those micro steps that will help move you along your path to wellness, the little wins, and celebrating the little wins. Just getting a little win for some people is a great start. That's your journey on how to find your right dose and how it relates right through your path to wellness.
Yeah, and we did talk about the 5 steps, but they are the 5 steps to our the path to be well program, and one builds on top of the other, but it does start to be clear. And Paul touched on briefly not to introduce too many variables. That is so critical throughout the entire process, but even more so at the beginning. If you are considering cannabis, but you've just seen your doctor a day or two prior, and he's made some adjustments in your medication, give that time to see how you respond to that, what the outcome of that is before introducing cannabis, because the fewer variables that are in there will only benefit you to be able to really determine what is working, what's not working, what combination, those sorts of things.
So I think I'll just, recap briefly what it is that we've covered, I guess, over about the last half hour. And that is, we understand and get why often the first thing that people want to know is what do I take for, which is essentially what our topic is today. How do I find my right dose? And that, in our introduction, we talked about, well, doctors generally direct this conversation for every other medication, pretty much that exists out there. And what we're trying to do is empower people and teach people that you can do this on your own. But as we've talked in many episodes, if you don't have a handle on where you've been or where you're at today and kind of envision where you want to go in the future. So that's our be clear, our health selfie, and then be aware, setting a health goal. So the here and now and the future. If you don't have a handle on that legwork, this is where we would say stop. Get a handle on that. Understand where you're at. Really hone in on what your symptoms actually are, how often they're there, and that. And then that usually helps dictate the conversation insofar as designing a treatment plan. We have multiple resources for the health selfie, starting with episode 28 and 44, gaining clarity about yourself. For the health goals, episode 18. When you get to the point of designing your own treatment plan, we have episode number 32. And you don't have to remember all these numbers. Just I'm pointing them out. I'm trying to repeat them, but they're all listed there at podcast.weedwell.com. Some of them have unique titles. Doug likes to come up with some interesting titles, but it's in the title what it's about. In any event, if you want to hear about the cannabinoids, THC and CBD, we have 27 and 28 addressing that. Designing your own treatment plan and what goes into it and how to do it, episode number 32. And really, that's the meat and potatoes, if you will, of what's my right dose? How do I find my right dose? Once you get started, as you just pointed out, Mark, limit changes and try to just make the only variable, if you will, the cannabis that you're taking. So don't introduce too many strains at the same time, too many methods of consumption at the same time, because it'll be harder to figure out what's doing what's working, what's not working, what's giving a side effect. If something negative happens to you, you want to be able to pinpoint what that is as well. But in any event, start low and go slow, titrate, and journal and listen to your body. So your body is telling you what to write down in your journal. Listen to what it's saying. It generally directs what it is that you're going to do in adjusting your cannabis dose. And then finally, as this takes hold and hopefully you begin to feel better, episode 36 talks about different complementary and alternative medicines that are out there, things that just you can we'll say tuck in or add in and really help you along to your path to wellness. But once you're at that be well phase, we want you to start considering another health selfie, because if you made it from here to here to begin with, you can always go now from here to there and continuously move forward on your path to wellness.
So great summary, Paul. For those listening, either today or in future episodes. I just want to reiterate, like we've covered a lot of ground here today, um, somewhat at a high level. And if you feel that that is maybe even confusing to you, um, I would encourage you to go to those podcasts because it'll dive in a little bit deeper, maybe bring a little bit more clarity, and you can spend, 20 minutes or so on one podcast and really digest that and reflect on that before going to others that you would like to see. Where today we covered a lot of ground and introduced a lot of different concepts. So don't be overwhelmed by that. Don't be turned off by that. Digest it. And if you need more, there's more in our podcast. So, Paul, next week, the topic next week is actually your chronic medical condition. So, what can our viewers expect next Thursday?
So, we often talk in terms of you're dealing with your chronic medical condition, and I was thinking to myself, we've never actually really defined that, and I think this is something important to define and talk about because these are all the underlying things that are going on, not necessarily your only treating condition, but these are the underlying things going on. I thought we would have a pretty good conversation about that. I would just want to mention one other thing to piggyback off what you're saying from a high level discussion standpoint, Mark, and that is weedwell.co/map. What we've done is gone through the roadmap today. We've done it the last 3 weeks for sure, but today we've gone through the roadmap and measured it back to how do I find my right dose. If this is something that's interesting to you, but as you said, we covered a lot of things and went through a lot of sections. Weedwell.co/map. That's the roadmap resource, but it'll also start the conversation. And you really start, we'll say, slow things down for yourself, and you can begin learning, we'll say, at a pace that's where you're at, and then you can figure out if you're a little further ahead, let's say, and be clear or be aware. But that's the simplest way. As opposed, if you're not ready to pull this podcast and that podcast, weedwell.co/map. Start the conversation. We'll have the conversation with you.
Excellent, Paul. Paul, as we both know, how quickly a week goes by, even if we're limited to activities outside of our home, they do fly by. So I have every reason to anticipate that next Thursday is going to come around rather soon. And I am looking forward to that because I thoroughly enjoy these sessions, Paul. And I believe that our listeners do as well. So, Paul, thank you. This was great again today. And I'd like to do my disclosure because it's my job and duty and responsibility to do that. So I'd like to remind our audience that these information sessions are intended for individuals who are generally in good health, are generally well adjusted, and are functioning effectively and are not in need of medical treatment, and that includes mental health disorders. These information sessions do not involve the diagnosis or treatment of any medical or mental disorders and do not prevent, cure, or treat any mental disorder or medical disease. Further, these sessions are not a substitute for therapy, counseling, psychoanalysis, medical treatment, substance abuse treatment, or the advice of and services of a medical professional. It is your responsibility to seek independent guidance from medical professionals to the extent that is necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option. Now, for those of you who have taken some steps in improving your quality of life, congratulations. We applaud that. And remember, your journey is your journey. And as long as you're taking some steps forward in improving the quality of your life, you should be proud of the progress that you're making. At Weedwell, we are committed to helping people improve their quality of life. And utilizing cannabis as a treatment option is one way to accomplish that. On behalf of my colleagues, Doug and Paul and myself, we look forward to the next time that we connect. Until then, be well. Thank you for joining me. I'd like to take this time to share with you how I first became interested and then involved with cannabis as a medicine. My name is Mark Tremblay, a founding member of Simcoe Holistic Health, Ontario's first medical clinic dedicated to the treatment and care of those patients considering cannabis as an option. As a teenager, I did sample marijuana and quickly concluded that it simply wasn't for me. I'll admit I did find myself judging those who did consume weed, thinking that their sole motive was strictly to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, our clinic has operated under 4 Health Canada regulations and served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families who experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. As we continue to grow and expand our reach, Simcoe Holistic Health is rebranding to Weedwell. For more information, visit us at weedwell.com or follow us on our social channels. Till the next time, be well.